You know, it's true. As we go through life and as we get older, well, you know, we love to look and feel our best. Especially, it's so important to keep our bodies as healthy as can be. And when you think of your bones, well, you not only want them to be healthy, you want them to be strong. And that's what we're going to be talking about today, our bones and our bone health. And joining me right now at South Coast Medical Group, of course, is Dr. Regina Dandy.
Hi.
It's so great to see you, Dr. Dandy.
Good to see you as well.
I'm so happy to be here. Now, this is the Richmond Hill location. This is a new facility here.
Yes, ma'am. We've been here for 2 months now, and we're just excited. Patients are excited about our new location, servicing the Richmond Hill and surrounding areas. We're offering a lot of services in addition to our primary care services. We also have cardiology as well as OBGYN will be joining us in May with Dr. Odom. We're offering walk-ins and hopefully real soon extended hours.
Why is bone health so important to us?
Osteoporosis is a disease that affects the skeletal system, and basically what happens is that it causes a loss in the bone mass or a deterioration in the bone tissue itself, and that can lead to increased risk of fractures, especially in the hip, the spine, and the wrist.
Is this something that can affect anybody at any time, or is it just women?
No, actually, osteoporosis can affect men and women of any age and of any race. Some risk factors include being of the female, Caucasian, Asian persuasion, postmenopausal women, women who no longer are having their periods, women who are thin frame, older individuals, those who smoke are at increased risk. Excessive alcohol intake are also risk factors for osteoporosis. Those who lead a very sedentary lifestyle, so don't get much exercise, and those who have a decreased calcium intake in their diet.
How are you diagnosed to have osteoporosis?
So basically, we do a risk stratification for those patients. So based on their medical history, their FRAX score, and their bone mineral density test. The FRAX score is a tool that we use as a survey for risk factors that was formed by the World Health Organization.
So this is not anything that's new, it's something that's been used.
This is something that's been used, and it's used worldwide.
Okay.
And it basically assesses a patient's risk of a fracture over a 10-year period. That coupled with their bone mineral density test score. And the bone mineral density test score, we basically get that score from bone DEXA scanning.
So the DEXA scan, I mean, we're talking painless. It only takes about 5 minutes, but what a great way and an easy thing to go through to find out if you have osteoporosis and what's going on inside your body.
Right, right. The DEXA scan is meant for those ages 65 and older, but obviously if there's any increased risk factors, any history of fractures in a person younger than that, some folks who are on prolonged corticosteroid use are at increased risk of osteoporosis. So we do some screening earlier than 65, but it is recommended that for all women ages 65 and older.
Let's talk about the treatment options if you are diagnosed.
Okay. Well, calcium is very important. Not only is it important for our bone health, it's important for our teeth, it's important for our heart, our muscle, and our nerve. We find calcium not only in milk, but low-fat milk, low-fat soy milk, low-fat yogurts and cheese. There's certain extremely green leafy vegetables that one can eat that has increased calcium in it. Broccoli. Also, nuts, such as almonds, have a high calcium intake, so we can get calcium in other areas outside of just milk.
What about a calcium supplement? If someone wanted to take a calcium supplement, is that something important as you get older?
As you get older, yes, calcium and vitamin D supplements are important, and it's important that you discuss with your physician so you're not taking too much calcium, that about the right amount of calcium for you at your age.
Well, you guys do it well here at South Coast Medical, and I love the facility here at South Coast Medical in Richmond Hill.
Thank you.
Thank you so much for letting us bring our Southern Scene cameras in. I hope you'll invite us back and hope to see you soon.
You too. Thanks.
If you'd like more information on this particular issue, or you'd like more information on South Coast Medical, all you have to do is go to the information you see on your screen. You'll find out all the information you need to know. Also, you can find us on Facebook, The Southern Scene, or check out our website, wsav.com, and just go to our Southern Scene page. We'll make sure we put you in contact with the folks at South Coast Medical Group.